Hi there, my name's Mark Perren-Jones and welcome to my course. Now in this course, you're going to learn this incredibly powerful therapeutic tool called active release therapy or active release muscle or massage therapy. It is an incredibly powerful therapeutic tool as a standalone treatment. But not only that, I'm going to teach you how to treat your massage clients with this. I'm going to teach you how you can do treatments on yourself, most importantly, to keep yourself out of pain. And I'm also going to teach you how to give your massage clients self-treatment so they can do this treatment on themselves to get better results between your massage sessions. But that's not all. In this course, I have jam-packed it to give you the best possible therapeutic outcomes. So, as I say, ARMT you can use as a standalone treatment. But I'm also giving you in this course my full body deep tissue myofascial sequence, a full body myofascial massage sequence that you're going to get included in this course. Not only that, I'm also going to teach you, if you want to learn all about the trigger points in my specific method to make learning trigger points so easy to once again get better results. I'm also going to teach you, again, if you wanted to do this as well, cross-fiber friction techniques to once again get better therapeutic outcomes with your clients and with yourself. So I'm going to teach you all of these things step by step. You'll have everything you need to know to treat your massage clients, to get them to do treatments at home between your sessions, and again, most importantly, so that you can treat yourself. And within the first 3 to 4 minutes of this course, I'm going to start getting you to treat your own neck, to loosen up your neck so that you feel the incredible benefits of active release therapy. So what is active release muscle therapy? Well, it's known as soft tissue release or pin and stretch. It's an absolutely fantastic therapeutic tool that you will see fantastic results. I'm going to teach you everything you need to know along this so that you can treat your massage clients, but most importantly, I'm going to show you how you can treat your own pains, your own areas of stiffness. Massage therapists, your poor forearms and your hands. I'm going to show you how you get spectacular results by treating yourself, but also your own clients. And if you're not a massage therapist, you've got aches or pains, I'm going to show you how to treat yourself as well. So anyone can do this course. We're going to start looking at treating muscular problems, stiffness, tightness, pain, joint restrictions, tendon problems such as Achilles problems. We're going to look at things like tendinopathies, tennis elbow, golfer's elbow. All of these things we can start addressing. So we look at joint stiffness, muscular problems, tendon problems, scar tissue, adhesions, trigger points. We will address all of this throughout this course. It's very easy to learn and it is absolutely fantastic. So who can you treat? Well, you can treat people for performance like sports, athletes, if you've got runners, athletes, people that are really active, hikers, bike riders, this sort of thing. You can not only decrease their rate of injury by getting better balance in their muscles and tendons, but you can also increase their strength, power, and speed by getting better function through the muscles. So we can treat those type of people. We can treat people with pain, joint restrictions, and the people at the opposite end of the spectrum from the active ones, people that are sedentary, people that are driving or sitting at computers and they've got those aches and pains and their bad necks, stiff through the front of the shoulders. We're going to look at those as well. So we can look at post-injury work as well. So we can help people get better more quickly. Chronic problems such as stiff ankles, all of these things we're going to look at. It's very simple to do. It's very simple to understand, but don't think for one instant when I talk about simple that it's not incredibly effective, as you're about to see very shortly. Okay, so what I want to do is just demonstrate something about your muscle tissue, okay? So when you've got tight bands of muscle, so I want you to think about maybe it's your massage clients with, say, tight hamstrings or tight calves or a tight neck. Might be yourself. You've got a tight neck. So what I want you to do for right now is just to find tight muscles. Now, an easy one to generally find is your pectoral muscles, okay? So just try and go different things and just start feeling, get a stretch on it and see if you can feel, do you feel a tightness area? Now, what you're not going to feel is, oh, the whole thing's tight. What you're going to feel, there'll be tight bands, won't there? Try the other one. Okay, so where do I feel this? I feel this exactly here. And if I palpate that, I can feel that tight muscle, right? Do I feel it through here? Not at all. So you'll be feeling tight bands or a tight area along the muscle. Let's do it again with your neck. So just sitting there, okay, you can hold on to your seat if you want to keep your shoulders depressed like this, and just take it across. All right? And see, where are you feeling the tightness? Now, odds are you're feeling a certain area, like I feel it just from here to here. Okay, if I do this side, same thing. I don't feel any stretch along here where the trapezius is. Nothing up here, it is really here. So I've got tight muscle in here. So if you were to say to me, okay, with massage, you've got this tightness, just try and stretch that. So I want to go home, I want you to do these, 30 seconds each side, several times a day. Now, why this is not very effective is this reason. Imagine this is that neck muscle, right? Okay. Now, this is the whole length of the muscle. So, if I do this, what's stretching more? The yellow, isn't it? Okay. The yellow represents, now if I do that, there's no stretch in that, is there? Or very little in the black. Doesn't matter which way I go, it's the yellow one that's doing all the stretching, right? And that's what's happening, whether it's muscles in your forearms, your hamstrings, the calves. What happens is you're just overstretching the healthy tissue. This is not going anywhere. This is that tightness there. This is that tightness there. So if I was to stretch my pectoral muscles, okay, what's happening is this is happening and this is not happening. It is all bound up here. So that's where we're going to address these issues. We are going to lock off this. So because what we want to do here is get this to stretch. But if we do this, that's what's happening, isn't it? Nothing going on here. It's all coming from the, if this was the case, from either side. But that tightness is just getting stretched at both ends of that tight muscle. Same here. Both ends of that tight muscle. If I go to my pectoral muscle, the pectoral, if I was to show you like that, right at that end point there of the muscle, is basically what's going on here. So no stretch through here, but that is where I'm feeling that tightness. But of course, that tightness is not getting addressed properly because, once again, it's all coming down to the healthy tissue that's doing all of the stretching. So how do we fix it? How do we loosen this off to get rid of these tight bands so it all becomes one long healthy tissue? That's what we're about to address. All right, so I want to give you a very quick little demonstration of what we're going to do. And then, of course, I'll show you from different parts of the body, advanced techniques, different variations, but just very simply so that you get an understanding of what we're talking about. Right, so as I said, it's sometimes called pin and stretch or lock, lengthen and release. And I think lock, lengthen and release sounds pretty good. Right, so let's just do this for the forearm. You can do this with me, okay? So, okay, what we're going to do is we're going to have our hand not in a, so we're not going to stretch our forearms first, okay? We want it in neutral, or as I'll show you later on, a shortened position if we're going to stretch, okay? Now, so what we'll do is just halfway down your forearm, well, first of all, just feel the stretch, okay? How does that feel for you? Is there any areas of restriction? Now, let's just say that you feel, yeah, I kind of feel it really tight through here. Right, let's do that. Let's address that. So, all right, hand into neutral. If you can feel those tight bands. Again, if you can't, don't worry. Just for the moment, just press onto a muscle. So we're going to press in. Okay. Now, on a pain scale, 0 being 0 pain, 10 being excruciating, you never want to be more than a 5. So if you're pressing in and going, oh, it's really sore, oh, yeah, you're too much. Because what's going to happen, you're going to contract the muscles because your body's going to fight back. It's going to contract. You're going to make yourself sore, and we want to relax the muscles, not contract them. Right? Okay. So what we're going to do, when we do the lock, we're going to press down and take the skin slack up. I'll go through this 100 times, so you don't have to worry. But we're going to press down onto that muscle belly, okay, or tendon or whatever it might be. Press down, and then we're going to down and pull the skin slack that way towards your elbow. All right. So lock and skin slack up. Now, see that? Now we've lock, lengthen, which is the stretch or pin and stretch, and release. And we're going to keep working our way up along those muscles. We could do all over these muscles, address all of these muscles, all of these tendons, retinaculums, you name it, we can address it all. So we started here. So I want you to do this with me. Start here and then go a finger width up, a centimeter, half an inch. Press down, take the skin slack up away from the wrist. So we're pulling that slack up there, okay? Press, in, and now stretch. Now, don't make it too sore for you. If you're pressing too hard and that's too painful, then you need to back off your pressure, all right? So you can double up your fingers. I'll show you all these different ways, forearms, fists, heels, double thumbs, all that sort of stuff, but just for the moment. So, and we would keep working press, skin slack up, stretch. So keep coming back to neutral. Okay, skin slack up, stretch. And I kind of keep working. And you'll see as we get further down here, the more intense it will become. So just watch your pressure. Press down, skin slack up, and stretch. So what I've been doing is hand in neutral position. Now again, this is hurting my shoulder having it up for you, but just to show you for the camera, actually we'll swap over. But you can do this down here on a table while you're watching. So just again, those simple concepts. All right, let's find a tight band of muscle. Got one. All right, let's start here. Press down and drag the skin slack away from the hand. Okay, so skin slack going towards the elbow, straight that way. Press down in and then stretch. Slowly come up, release, lock, lengthen, release. Or if you like, pin and stretch. And we keep going along. So now we are working that black elastic band. All of that nice, the yellow healthy tissue is not getting affected because we have effectively locked it off. We have taken it out of the picture. So we're no longer stretching all of this only. We're now focused completely on the area that needs to be focused on. So, as you can see, no more than 5. So it is simply a press in, pull the skin sack up, and stretch. All right, and so that is what we're going to be doing. If we went back to our pectorals, okay, again we have start in neutral. Again, don't worry if this is a little bit confusing for the moment because it won't be. So we wouldn't start out on the stretch position. We start in a neutral position or shortened, okay? Let's just start at neutral. So we'll start basically in the midline. You can feel these tight bands of muscle here perhaps. All right, if you feel them, just press on it, okay? So press and we're going to stretch this way. So we're going to pull towards, skin slack towards, because we're going to stretch, because we want to stretch this area. So you're stretching away from that area, okay? If I stretch this way, well, that's giving it slack, aren't I? So if I press in, stretch towards my breastbone, sternum, and you've got to go very, very gently. But what we're doing now is we're starting to lengthen, get these shear forces on the fascia and the muscle so it starts to slide finally. So these tight shoulders that you've got the computer, you're watching this course, all this sort of stuff, we're now finally addressing the tight areas of the muscle. And we're going to do that all over the body. Okay, so what we're going to do now is we're going to loosen up our necks. Who doesn't want a looser neck? We've got tension, tightness, stress. Right, so what I'm going to do, we're going to first of all just do some very simple ranges of movement to just check how tight we are, if we've got differences from one side to another. Now, on that, if you're a massage therapist, physical therapist, osteopath, chiropractor, someone that's got worlds of experience and knows all about assessments, active, passive, resisted, all this sort of things, special orthopedic tests, by all means you can use them as we go through our course to assess your clients, their range of movement, all that sort of thing, then please do them. I'm not teaching that in this course because that is a course in itself, just teaching how to do assessments. But if you're someone that's going, you just look at me blankly going, what did he just say then? Passive, resisted, what? Don't worry. All you need to think about is, okay, if you can see that you've got better range, you can turn your head further, for example, or it just doesn't hurt or doesn't feel as stiff, that's all you need to think about at the moment, all right? Righto, so let's have a look at our necks because I want to go through something that's really important. So let's just check. So what I want you to do is do this with me, okay? So let's check, and I want you to notice if there's a difference from one side to another. So let's start with turning to the left. Okay, see how far you're across there. If you need to close your eyes, you can, if it makes it easier for you. So do you feel tighter from one side to the other? And yes, I feel tighter going to this side. All right, now let's do side bending. So keep looking forward. You'll have very often people will do this, and your clients, massage clients, will do this. see how they turn their head across? That starts to bring into different muscles, levator scapulae in particular. So what you want to do is make sure it's ear to shoulder. So keep looking straight at the camera, well, straight at your screen. I'm at the camera. All right, so once again, if you need to close your eyes and find out, I am most definitely tighter through here. No two ways about it. This is actually quite good, this side. This side, absolutely, I'm way stiffer, all right? And to the right, okay. So now what we're going to do, we're going to do the same thing, pin and stretch. So what we're going to do here, so I'm through here, we're going to lock down the trapezius here. So with your opposite hand on the top of the muscle here, you're going to lock down, and what you can do is press down and press towards your shoulder. So the skin slack, we're taking the skin slack up through here, because we're shortening, this is the area of problem, okay? And then what you can do is, now you'll see, go slowly. So we're starting in neutral, right? Could we start in the shortened position? Yes, but we'll get to that, all right? Let's just start at neutral to keep it very simple. So press down, take up the skin slack that way, and then you'll see, go slowly, there's very little movement left because we've really wound these structures up, okay? Now, you can also stretch the trapezius, well, you're stretching it this way, okay, and turn to the same side will also stretch it. So, go slowly, remember, no more than a 5. All right, now we're going to come up slightly, still on that trapezius muscle, press down, slack across, and now, I want you to know, because this is going to be important through the course, that my fingers are not sliding along the skin as I do it. It's not this. This is a technique I'm going to teach you actually, but for the moment you need to know that what we're not doing is this. It's not sliding. It is pinned. It is locked there. So if you're going and then your fingers are sliding, that's wrong. But it is another technique, as I say. So what if you're, so let's just do that, okay? Now, problem is, it's quite warm in here. I'm getting quite sweaty, okay? So my fingers, I can't get the gripping. This is going to be a problem. Well, it won't be a problem, but this is what you're going to have to realize when you're using massage oils, again, which I'll get into, because then how are you going to keep it? Right. You get yourself a little towel, it's a microfiber. Now you've got to be careful because when you use this, it's a lot grippier than just using your fingers. So we'll get back to that spot there. Same deal, neutral, press down, take up the slack. And now there is zero slip. And this is what you'll do, which I'll show you when you're doing massage with oil, and then you want to do your pin and stretch. So you got that, and you can do that through a cloth and then get back to your massage, and I'll show you all about that. So that's if you're thinking, how am I going to do that with massage oil? We got you covered. Right, so if we want to do a few more repetitions, okay. So neutral, press down, take up skin slack. Slowly, once you get to that stretch, you can release, come up. There's very little movement now because we just got this much through here, this really tight band. So go up, come back, you can do right. All right, so you could do that and you could repeat that a couple of times. And now, so if you've been doing this, watching me, if you've been doing this, now of course you can do the other side just to keep this quick for the lecture, but then reassess it. And I do not have that pulling that I had when I first started this. That is, I don't know whether you can see on the camera, but that is way, way, way freer. And likewise here. Now I'm going to have to do this side because this feels, now I can feel this winding up in the trapezius as we stretch it, coming around here, because when you go to this side, it stretches the trapezius. That's why I was doing, when we were doing this, it stretches side flexion and also rotation to the same side. So, see how easy you can do this. You can start working on your own neck. So think what you were doing, maybe a little bit of massage, maybe trying to do this. Remember with the elastic bands, it's pretty pointless doing that. Now you know that you can pin and stretch it and get way better results. That's just for yourself. And of course, we're going to address with our clients. But just remember, we're going to use our cloth. So if you're sliding, same thing here. If you're perspiring a little bit, or you've got moisturizer on, or massage oil, or what have you, we're going to use the cloth. But do remember, as you'll find out, when you do it with this, it gets a lot more grip. So you're just going to have to be aware of that, especially when you're starting to work on other clients. But that's why I wanted you to feel it for yourself, so that you go, oh yeah, so I'll have to be a lot more careful. But there you go. All right, let's move on.